So knee pain at the front of the knee here is massively common and often really debilitating when you're trying to squat up and down, if you're lunging in the gym, or going up and down stairs, or even if you're sat in a chair where your knees are bent at 90 degrees, you're going to feel that pressure building up at the front of the knees, which can get very, very painful. Hi, I'm James the Osteopath. We have 3 clinics here in the UK and we're going to be fixing your knee pain today. So from treating thousands of knees, it becomes very obvious as to what is causing most people's knee problems. And we're going to be running through 2 major things today. Number 1, how your big toe joint, the first MTP, can affect your leg and your knee joint and how we fix that. And then after that, we're going to run through the typical classic tightness and weakness that people get through these areas in the knee, which again will cause that knee pain. So the first thing that we're going to be talking about is how the big toe joint, the joint through here, can actually affect your knee and cause knee pain. Now, when we're looking at the big toe joint, you want a certain thing through this area. You want full range of motion and flexibility. This joint here, this first metatarsal phalangeal joint, should have extension to 90 degrees. So it should bend all the way up like this to 90 degrees, just like this here. So you may be asking, what's the problem with your big toe joint not being able to extend all the way, and how can that affect your knee? Well, basically, when you're walking, you want your foot to roll off the top of the foot like this. And when you do that, you'll notice your big toe joint will extend. If you've got that restriction through there, then you're unable to roll off the top of the foot. You'll slightly externally rotate your foot and you'll start walking off the inside of the foot to work around that extension that you haven't got. What you'll notice here is sometimes you build up a callus on the inside of the big toe, a callus on the ball of the foot there. And you may even notice that the joint here, the first metatarsal phalangeal joint, is actually a little bit bulbous, hypertrophied, bulky, and you may get that deviation of your big toe inwards and potentially a bunion starting, which is not a good thing. Well, specifically to the knee joint, if you're externally rotating, what that means is that your whole leg has to externally rotate. And then when you're walking, rather than you walking straight, you've externally rotated, and you can see there's a torsion at the knee joint, which of course is not a good thing. So rather than having that torsion through your knee joint, you'd be better off extending the big toe, creating more flexibility through this area, which will take a lot of pressure away from the knee joint when you're trying to walk. Now, the exercise required to create that extension through the big toe is a simple stretch. So I want you to stand facing a wall or anything like this in front of you, and then you're going to place your foot on it and push yourself down like here, and you will feel that extension through your big toe. You're going to hold that there for a minute and do that one 5 times every day. But remember, it's very small, delicate areas. So it's a case of going gently pushing down and not forcing it too hard. So that's the first thing to check with knee pain is, does your big toe extend fully? And if it does, you're fine. If it doesn't, of course, go into the exercise I showed you, get the stretch through that area, increase that extension through the big toe joint, and then that will take a lot of pressure away from the foot and the leg and the knee. So getting into the most common cause of knee pain here at the front of the knee, it's because of a maltracking of your patellar. So the patellar is the kneecap, and patellar maltracking basically means that your kneecap is not running smoothly in this joint. So rather than your kneecap sitting smoothly in a groove and running like this, it's being pulled off to the side, which means that yes, it's still there, but of course it's clicking and grinding. It feels painful up and down stairs, squatting, lunging. It all starts to get a bit what we call crepitus, which is that clicky grindiness. And that indicates that your patella, your kneecap, is out of the position it should be in and it's not running smoothly. So one of the most impactful stretches you can do for this area to release off that tightness, which takes all that pressure away from your kneecap, is a simple quadricep stretch. You've probably done it before, but I'm going to tweak it slightly to make it slightly more effective. So in this position, catch your foot and bring it to your bum. Now here, I want you to bring your knees together, bring your knee back, and then stand up tall and push your hips forward. So specifically, that's knees together, knee back, and then push your hips forwards whilst keeping the heel pulled up to the bum. You're going to feel a deep stretch all the way through your quadriceps, and I want you to hold that one in this position for a good 5 minutes and do that 5 times every single day. Now, if you want to specifically target the vastus lateralis and iliotibial band, which is not going to be targeted on its own through a simple stretch, we've got something called a foam roller, and you can use this specifically to get directly into those muscles, release off the tightness, break down some adhesions, increase blood flow, and release off the tightness through here, which will take pressure off your kneecap. Place this on the floor, and then you're going to lie on your side in this position so that your iliotibial band, the side of the leg and sides to front of your quad is on it. And you're going to move yourself up and down like this until you find a painful little spot. There I've got one, so I'm holding it very still right on that spot. You keep the pressure there, and as you do that, you'll feel the pain melting away, easing off. Once you've done that, move again up and down until you find another hot spot. Get the pressure onto it. Again, it's very, very painful, but I'm holding it still. You hold that there until you feel the pain easing off. So if you haven't got one of these at home, they're very easy to find online, but if you haven't got one, you can get something like a rolling pin or a deodorant can and then roll a towel around it. So it's going to be smaller, but at least it'll be relatively firm and you can lie on that on your side. So for the next exercise, it's going to be a strengthening exercise to make sure we get that VMO muscle really hit hard, and we've got to do a Peterson step up for that. So grab yourself a box like this, or you can use the first step in your house if you've got one of those, any sort of step that's around this 6 to 8 inches high. So what we're going to do, we're going to stand on the step in this position here so that you're in the middle of the step and this foot is flat on the floor. The working leg, where we're working the VMO muscle, is up on the step. You're going to simply step yourself up, and as you do that, you're going to flatten off this step here, this leg here. So it looks like this, flattening off to there, and then when you come down again, back up onto the ball of the foot, and then flattening off, and then back onto the ball of the foot here. Now you can see that I'm making a big effort not to push myself up with this leg, because this needs to be the working leg. So it's an end of range step up, specifically targeting the VMO muscle, and it's a slow, consistent movement on this leg specifically. After doing 10 to 15 repetitions, you will start to feel a burning working of this muscle, the VMO muscle, and that's exactly what we want to be achieving. So what we've done for that strengthening side of things is that we've isolated the VMO muscle. We're now going to integrate it into a bigger movement, and that's going to be a static lunge. So in this position here, I want you to bring the working leg at the front. Keep your heel flat, so the foot totally flat with this leg. This leg's going to go back to support, and we're going to come all the way down like this, and then 3/4 the way up to there, keeping the weight over this front leg. Don't fully extend the leg, keep the weight over the front leg. All the way down, and then 3/4 the way up to there. So potentially a more effective way to do this static lunge is by raising your front foot 4, 5, 6 inches. The reason why this is effective is because you've got that raised foot here, which means you can get deeper through your front leg, but also because your front foot is raised, there's less weight going down over the front leg. So we've reduced the weight, but actually increased the range of motion we can achieve. So in this video, we've ran through how the big toe joint can give you knee pain through a restricted extension at that joint, which will then of course affect the knee. And I've shown you the exercise to get rid of that. We've also run through how pain at the front of the knee and maltracking of your patella could be through a tightness and a weakness around the muscles here. And we've had exercises there that can reduce the tightness and also strengthen the knee. So thank you for watching. My name's James. Now please like and subscribe. And if you've got any comments and you would like any help, please comment down below and I'll get back to you.